Let's get rolling. My name is Andrea. I serve as the Deputy Director for the Office of Faith-Based and Community Initiatives. The Office of Faith-Based has been around for several um, years, decades, but was relaunched in November with Governor Stitt with kind of a new focus that instead of it just being the Department of Human Services, that it would touch 5 different agencies and we would work collaboratively and be able to say that word correctly 5 times fast with different agencies on some specific topics. So before I dive in, let me tell you a little bit about me. I do this in my spare time. I also serve as a pastor's wife and on local church leadership. I parent 6 children. They are from ages 6 to 25. And you need to do the math. That was pretty fun. When we welcome back in a baby, despite everyone in college or out of the house. And so that keeps us on our toes. I have a bachelor's in mathematics education. So I was looking over there. There were some really cool graphs and I saw some regression formulas. And I was like, oh man, we could just like dive into algebra 2 trig today.
Yeah, I'd be the only one here.
And then my master's is actually in adult education. And so one of the beautiful things about being in this position is community and faith. So I started over 2 decades ago as a foster parent and working with a church. And what I found out is that some of the things that we ask families to do in the middle of trauma and crisis, we give them no skills and no programs and no help on how to get there or change or be better. This was just an eye-opening experience. You all probably all do that. I did not. It was interesting. People is like, we're asking you to cross this crazy river, or at the same time, without giving them a boat or a life jacket or like steps. My dad used to always tell us the joke, "How do you eat an elephant?" Only we didn't actually get bites or steps or how to get through things. And so that's a couple decades ago is when I started community work because I saw that there's some gaps. There's some things that really only the community can fill. And there's also some things that really only the church can fill. There's programming, there's populations that you guys are serving and seeing. And so when we all come together to work collectively, that's when we start actually seeing impact. That's when we start seeing change in our communities. That's what actually affects our state. That's what moves things forward. So very excited about this position and the work that I get to do. And I'm going to trip over this chair. I don't move it, so I'm just going to go ahead and move it. Let's see if the clicker works this time. Yes. The Office of Faith-Based is made up of the director, Brian Bilbeck, and myself. And yes, that's only 2 people, and we serve statewide. But we have liaisons from our 5 different agencies, along with some other community partners. This is just who we were able to picture one lucky day. So I work with Leo Brown, and he's with Department of Corrections. Jamie Majors at Human Services, Emily Morrow at Department of Mental Health and Substance Abuse. Tim Tardibono is the director over at Office of Juvenile Affairs. You all know this face? Ms. Delbie with the Oklahoma State Department of Health. And then Paul Abner is with the Oklahoma Faith Network, which works with 6 different denominations. And I also have a representative, and he wasn't here for this picture, from the Catholic Archdiocese. And so just kind of a little bit about who we are, who we serve, and the agencies that come together in order to make this effort. Also not pictured is our representative from the governor's office, because we do strive to keep those in mind. A little bit about the faith-based office. We really exist to foster meaningful relationships and collaboration across government, churches, nonprofits, faith-based community organizations, however you want to name them, whatever you want to call them. Our office is there to do some collaboration, and that's looked different in different communities. I'll go through specific examples because this is kind of like nebulous. What does Andrea do on daily? Do you get the idea by just reading this?
Oh.
No, not at all, right? And so I want to break it down. There's two big things that we do, and that's connecting and recognizing. And I have specific stories about connecting, but I want to stop on recognize for just a second. So what the intention of the office is not actually to grow government. Unfortunately, I also have no money to help you. So sometimes I hear about grants and I'll share it out. But what we see is there's some amazing community organizations and churches across Oklahoma making an impact, doing something really cool. Those are the voices that we want to elevate and share about. And those are some of the connections that we make. Maybe that organization that's doing amazing work with prisoner reentry in Chandler. And another church says, hey, this is where our heart is. This is what we're interested in. Let me tell you about this organization and how they got started. Maybe that will help you. It's just connecting and recognizing. I've told you who the agencies are. So let me tell you a few stories. Everybody like story times?
Yeah.
Okay. One of the first things we did as an office, so keep in mind we were only announced in November. So as an office, that is not even quite a year. Although I just celebrated my 10-year anniversary with Department of Human Services. Thank you. This is the first applause I've gotten. They tell me my certificate will be mailed, only I've never seen it yet. Yeah, no, good luck, exactly.
At your 15 year, you'll get it. You'll get your 10 year.
Okay, good. See, things to look forward to with state government. We used to like all sit in like a big building, and there would be like a full staff meeting, and like they would announce you, and there'd be like cookies in the back. My 10-year came and went, and no one remembered or recalled. But here I am. So I guess we're doing something right. So this family was super cool. So announced in November 7th, and it was either the day before that announcement or the day after the tornadoes went through Hera. And they're like, okay, your office is faith-based. What can you do? I'm like, sure. Welcome to the ballgame. What I found out quick is the churches were mobilizing. They were connecting with organizations. You know, Oklahoma is really, really resilient. We're pretty resourceful too. There was just no one actually putting all the pieces together in one place. You kind of had to hunt and peck. I'm really good with Facebook, finding out who's doing what. So we put it together. This specific family, they have 4 children, and where the tornado hit and totaled their home, a tree actually came through and landed on a child's bed. But that child happened to not be sleeping in their room that night. They were in the living room on the couch. So family completely fine, but everything lost. She had actually put out on social media that they were looking for resources. And Hera Church came and wrapped around this family, from immediate shelter to helping them pack and salvage through what was left, to helping them get food, to then moving them into a new rental home. This church wrapped around this family, and they were just one of many of the organizations working together. They were actually partners with Convoy of Hope that was coming through. Just really, really cool. Right there in the moment, serving their people. Governor Stitt recognized this family at his state of address. It was just a neat connection. Put together a list. This is who's serving. People get served. This connection came out of the wildfires that struck through our state. This specific family was up in the Edmond Guthrie area and was serving as foster parents, and had, I believe, 4 kiddos on top of their bio kiddos with them. Fire came, everyone wasn't there, they were fine, but they literally lost everything. Like, she said that there were remnants of a metal ball bat that were left in her garage. This one, a local church was able to connect. We were able to connect them with an organization out of Tulsa. And the story, when I talked to her, it was so cool. We did a press release on it. She had the kiddos. I want to say the fires maybe it was like a Thursday. The kids, was it fall break? Spring break? I don't know. There was like a long weekend, maybe President's Day. I don't remember exactly when they hit. So the kiddos went to a family member and she said, when you get back, it's going to all be okay. Go enjoy your time this weekend. I think that that's an extremely prophetic statement of a woman of faith. Because I could not imagine looking at my kids and telling them that when I turn around and I can't even make heads or tails out of what used to be a little baseball bat. However, this family was able to find a rental home with office, our coordination with our local church serving them. This is beds. This was room decor. This was dishes. This was a couch, a kitchen table, all showing up. We had over 100 plus volunteers kind of cycling through the church that set the entire house up. And come Monday, when the kiddos, she went to get the kiddos, she got to bring them to introduce them to their new home, where they saw their brand new bedrooms with, I don't know if you can tell, these are even shoes in here. There's toys, so much that the kids thought it was Christmas. Went from a disaster, what could be like very earth shaking, to the church and the community rallying around. This story here, this comes out of Ada when the tornadoes hit. Sorry that there's so many disaster related ones. But what I find interesting is the timing that sometimes works out. Call it whatever you want to. Okay. So the tornado hits here. I call a local pastor that I know. How are you? Andrea, we're good. Okay, awesome. Let me know if any needs pop up. We'll help you. I don't know how we're going to help. We're two people serving the entire state, right? These are the things I say, and someone else fills in the rest of the blanks. The next day, I was doing a walkthrough at Bridging Hunger, which, if you don't know, is an amazing food organization. Churches from all over Oklahoma come. They serve for an afternoon. They can load up their vans, take back groceries, and serve the local people in their local communities in their church. I was about to head into that meeting when my pastor friend called back and said, "Hey, Andrea, actually a need did come up. The tornado hit a low income house that was 27 families that were displaced. And while a church is hooked up with the food bank, it's like a 5-pound can of beans, which is not going to help us at all right now. Like we're in shelter, we're staying in like church places, like we need like peanut butter crackers kind of thing." He's like, "You have any resources for food?" Well, I don't. However, I'm about to go in and meet these people, so I'm going to find out. So we finished our meeting with these guys, and they're like, "If there's anything we can do, just let us know. Don't tell me that because I will take you seriously." And I was like, "Okay, hey, y'all, actually, a church just called before. It's from Ada, and they said, we've got you." The pastor sent me this picture the next day. An entire truckload showed up of shelf-stable, ready food to serve that community in that church. It was just one of those like on-time connections. I can tell you, this is just an ounce of what it looks like. I can tell you stories. I was talking with a participant at the end of the first session. She's like, "Oh yeah, Calm Waters." I'm like, "I just met Calm Waters at a random luncheon that I'm not even sure why I was at." But the next day in the office, a child welfare worker came over and said, "A foster family that was just on the verge of adoption, the mom was just murdered. And what resources do you know?" Hey, I just met these people called Calm Waters, and they do grief support. I mean, they're just these on-time connections. That's all I'm doing. I'm just connecting, and I'm recognizing people that are doing really cool stuff. But the stories go on, but it kind of gives you a better idea. These guys are terrific. This is a faith-based free medical clinic. This specific one that I met meets in a church. They also have a campus that partners with the health department, and they use that facility once a month. But there's an entire network around Oklahoma that is doing this. And the thing that I really loved about meeting them and hearing their stories and how they have the volunteer pharmacist and what they can get for like discounted medicines and fighting diabetes and all these different things was they said, we normally only see patients for about 9, maybe 12 months. and then they move on. And I'm like, well, why do you think that is? And they're like, oh, Andrea, their diabetes is under control. Their mental health is in a better spot. Their teeth have been fixed. Whatever it is that helped them then see hope for that next step. They just got a better job. Now I have health insurance. They were able to move on to this. So I loved this like stopgap and how people were able to move forward, and love the work that they were doing. One last quick little story. This is Director Bobek. The Victory Church in Tulsa said, hey, we really have a heart and passion to serve Department of Corrections. What can we do? Training happens every once in a while with DOC. So we did some footwork behind the scenes and we brought DOC to the church. It was our largest training, 110 people trained in one day. That church now has over 200-ish, I want to say 220, maybe 230 trained volunteers. So we've gone back again. And they have just finished their third event. And I actually just got an update from the director who was there yesterday. They went into a facility, whoops, wrong phone. The joys of two phones, you never know where your messages are, and what's happening. So yesterday, over 43 church volunteers went, and 1,119 inmates came out and were ministered to. They served over 1,600 meals, ended up with 58 baptisms, 1,400 Bibles distributed, and 300 plus salvations of people that rededicated their life. God worked in the corrections on one day. This was because they said, here's our vision, here's what we want to do, how can we connect? Where do we go? What's our next step? And that's what we're here to help facilitate. We work on 4 different pillars when we kind of look at our work. If it's something that's strengthening fatherhood, strengthening families around food security and foster care and adoption. So when we're looking at our agencies and our work with each of them, it comes back to these 4 pillars. We want to help support the organizations, the churches, the nonprofits that are serving in these areas, that are strengthening their communities. We have strong communities, move the needle on our state. And we don't go all the way down and normally serve the individual. We serve the churches and help connect them. They're serving the individuals. There's 2 of us. Could I actually serve every Oklahoman? That would be crazy. But we can see stronger communities. I'm a big believer in the work that we do. We can't do alone. It really takes all of us working together. And so those are things that we work on. And now you have an idea, hopefully a little better, of who we are and what we do. And we're going to dive into a specific, I'll be sharing what we're doing with the health department and specifically for our pilot in Muskogee. But I want you to just stop and think before we get to that portion. How can we connect community partners to you? Or what connections would be helpful? This is an interactive part of the presentation today.
So in the last session, we actually, the people that attended Victoria, we're going to connect to you, Melissa, because they are interested in kind of what we're going to talk about, the pilot, just some of that same connecting of resources to churches. So she's the one that we're going to connect that group.
So who do you guys work for? Yes.
I was gonna say, I have a question.
Absolutely.
I know there's a community, they already have kind of a compassion clinic set up, but they have had seasons of like multiple physicians that come in and volunteer, and they serve individuals who are uninsured or underinsured. But then they have times when there's one physician and they're the only one showing up for 6 months. And so is that something where it's already established, but there are times when they're like really in a valley and they just need some assistance? Is that something where they could possibly reach out to you or delbie and say, hey, this is where we're located. We're really struggling to get another physician, because they have 100 people that come through that one
Mhm.
evening, right? And they're coming from all these other communities. So if we know of people like that are sometimes struggling to keep the doors open, would that be a good opportunity to connect them?
So I'm gonna go with me. Because I don't have a cataloging here of physicians that are ready to volunteer. However, as you've seen in my multiple stories, every once in a while, I have someone random reach out, hey, this is how I'd like to serve. And if that happens to connect with when someone reaches out, absolutely, we'll make the connection. I'm working with a pilot with the Assemblies of God because they came and said, hey, this is what we want to do. And so I'm going to introduce them to some key people in certain counties as far as state staff. Here's who you would want to know. Here's where you would want to go to learn more about that so that they can try what it is they're doing.
Also, that free clinic stuff you said,
Mhm.
maybe to get Karen connected to that free clinic association.
Yeah, there's like a statewide association.
Okay.
And like these guys were able to find some sort of grant, and I want to say their average cost was like $1.18 a patient. Like it was crazy. I have no idea with such a minuscule budget how they were able to do what they did. But the way that they were able to piece together, they're like, hey, we'll share our story. And so my connection might be back. These guys said that they would love to be a resource. But that's kind of how. Who are you? Who do you serve? What connections might be helpful?
So in Neckham County, we have two different congregations talking about starting a free clinic. We have no free clinic in our congregation, in our county. And I'm not sure if we have any in any of the surrounding counties either. I have to do a little research on that. There might be one in Custer, but either here or there. These two different congregations cannot seem to work together. What I would love to see is if the state agency could somehow find a way to help these two come together to serve this community. But it can be, I'm gonna use a political reference, it can be hard to cross that aisle, I guess.
You know, working with ministerial alliances, even in itsy bitsy tiny town that feel they need two ministerial alliances. You know, there's state government politics, which are pretty awesome, and then there's little town politics.
It's bad when you know each other's mamas. You can make it better, you can say, hey, tell him to straighten up that right.
Yeah, I know. So I don't know that we could come and say, hey, let's do this. If people are willing to work together and say, we're looking for a model, then we can come in and say, here's someone that you probably want to connect to. But normally communities are ready to cross that bridge together, saying, here's where we are, this is where we want to go. Because we don't want to get in a turf war, like that's not going to help anyone in the long run.
And hopefully it's not coming to that, I just.
Yeah.
But there are some successful ones, like down in Durant and in McCurtain County. There's two really good ones there, and she's aware of some as well that are.
I would love to be able to show them a picture of this is what it can look like, and we try to do this together.
And if I'll put up a QR code in just a minute, and it lets you guys send your information and kind of your ideas or what you want to do. I can at least make a connection back to the guys that said, hey, we'll share our story. We'll share how we found our grant and how we're funding this and what it looks like when we set up in the evening. So that might be helpful.
And that 365.
I just can't come and
that is the
necessarily.
Durant that I was telling you about. That's a free clinic at a church that our community health workers go set up every week there. So that would be a good one for you to get rid of too.
Before ours closed, we used to go out and do Medicaid applications and SNAP applications, whatever was needed. I brought car seats a time or two, whatever was needed, and then they were not able to sustain it.
Yeah, they were talking about the rise in the medical cost. I wish I could remember.
I think our biggest problem was our director retired.
Oh, well, they were telling me about like one medication they it, and then I wanna say it's like triple or quadruple, and so then what that is their per patient. But I mean, like, you're talking about resourceful people, making a local impact. It was phenomenal. Oh, if you're interested in seeing some of the stories, who we recognize under Connect, I have events and things about each state agency. Oklahoma.gov/faith and community is our website. I also run social media on Facebook and Instagram. If you want to follow and kind of see where we are and what we're doing. Every once in a while, I had federal cohorts. So most states across the US right now have a faith-based office of some shape or form. And we meet together monthly, and every once in a while we have some federal folks join our call, and they'll be like, oh, hey, there's some funding coming up. Like in July, we knew about some of the marriage and family funding coming out. Unfortunately, it was like a 2-week turnaround, so it was pretty hard for organizations. Rumor is with federal fiscal year ending that there might be another short window opening up with a couple of things, and so we're keeping our eye on that. But if we find out about things, social media is most quickly how we put that out. So I encourage you to follow. Also on the website, there's a place to sign up for our newsletter. I don't spam you. It just comes once a quarter. And I just want all of y'all to stop and recognize that this math major runs social media and newsletters because we're an office of 2. But it's a lot of fun, and there's some really cool things that happen, and we love to highlight them.
So typically, unlike the newsletter that you send out, is that to churches across the state or churches and faith-based organizations, or?
I have a lot of random people. There are people that are interested in what it's doing. Some are hooked with some of our partner agencies. So like some frontline staff within DHS or DOC, just looking to see what's happening and what are the resources out there. And so really anyone can sign up. I have organizational, denominational leadership, down to a layperson, down to a couple of mayors. It's anyone who's interested in just the general work of the office. So feel free to sign up.
Oh, I will.
Okay, so questions and answers. We can definitely throw them out too, but what I want to encourage you now is to grab your cell phone and to take a picture of this QR, and it's going to come up to a form. I tell everyone, as I told you at the beginning, I have 6 kids. I don't know if you noticed my perfectly dyed hair up here. Not dyed, all natural. It's affecting my memory as I'm getting older. So I tell people, if I tell you I'm going to send you something, please take a picture of this and remind me that I'm going to send you something. Otherwise, that something might not make it there. But if there's something that's helpful, if you have a question, something you want me to follow up with you on, this is a great way to share your information, and then I can follow back with you.
Victoria, when you guys send me churches that you're collaborating with, I send it to Andrea for her to have for her website or her.
Yeah. So as you're working on this, does anyone else have a question before? So this is kind of like a little bit about the overview of the office and kind of some of the things we want to do. And now we want to like switch over and deep dive into partnership with the Oklahoma State Department of Health. And one of the cool things we've been able to do together. And Delbie will share that with you, but I want to make sure that I give time if you have questions. I don't want to stifle that conversation.
I have one more question.
Okay,
But,
yes.
I mean, I'm following these instructions.
Thank you.
Okay.
So what do you tell churches? Because I know a church that they have really stepped outside the walls and tried to step up and serve people more. And they were actually nominated for an award, and they really went back and forth on whether to accept it or not, because they don't want to necessarily be recognized for it. And kind of my thought process on it and talking to the pastor was, I think you accept it. I think you absolutely give glory to God for it. But I think it's a great opportunity to show churches what's possible, because I think there's a lot of churches that want to help, they just don't know how. But so how do you talk to churches in not necessarily like recognizing, I guess trying to figure out how to use that word recognize where they don't feel like, oh, it's propping me up, but really showing them how it helps other people by sharing what they're doing.
You're talking about the, show?
No, it was a different one.
Oh,
Yeah.
So like the Heritage Church, I reached out to them before I featured them and I offered a meeting. I said, I'd love to tell you about who I am and what I do. And I would love to highlight the work that you did, because I realized that work like this wouldn't happen if the church isn't being the church. We sat down together, we had a conversation, and then got their permission. Have I had some that said, no, thank you? Absolutely. And that's fine. I do love to tell them that there are other people trying to figure out how to do the work that you're doing. And I want to be there to help connect them when they're interested and want to. And so sometimes that helps, but you know, what's interesting, like on the flip side, some people will say, well, you're the government and we're the church and we don't really need you. Like, absolutely. But if you have a vision and you can't figure out where that open door is to start, I'm happy to make a connection. That's all I'm here for. I'm not dictating anything. I'm not interested in being a part. If you want me to highlight your work, I'm perfectly fine with that. I love to highlight amazing things that are happening across Oklahoma, but I'm literally here just making connection. So it's a balance.
It is.
and sometimes them sharing their stories helps other churches, to think out of the box.
Mhm.
Because they want to do it, may not know how, and hearing somebody else's story, success story, gives them ideas. And it also motivates them to want to be like them as well.
I think it's less of a pride thing and more of an exposure thing.
Yeah.
Like you're not accepting this award to be prideful and say like, look what we did. It's more like, hey, look what you can do. Right. Get it out
For
there. Make it available.
And also helping the smaller churches, that may be a big church, and the smaller churches may be able to connect with them. When I first started years ago trying to do show awards and trying to get churches involved, I had a pastor say, well, if it ain't fried, it ain't going inside. Because we were trying to do wellness policy, and I had to say, I'm a PK, my parents are pastors, but I had to say, not trying to shake fried chicken, but also trying to just get you to add salad, and just trying to get you to add fruit.
Here's just more of a hard sell for some of that stuff.
It is.
But when I got them going, they love to get that award, and they love to post it on their social media. So it just takes getting over that.
Yeah.
So I'll go ahead and tell you a little bit about myself in this pilot. My name is Delbie Walker. I am Oklahoma State Department of Health Community Engagement and Health Planning Coordinator. I have the joy and the pleasure of working under my boss is here, Director Kathy Gillen. She's one of my favorite humans. One of my favorite bosses for sure, just her compassion for the community. I've had a variety of positions and roles with the State Department of Health and out locally, so I understand the work that you guys do. But then the last 3 years, I've transferred back to Oklahoma State Department of Health. Excited to just be able to be feet and boots on the ground. So I do serve as liaison for the Oklahoma State Department of Health. So I get to meet with Andrea and her team bi-monthly. And what I do is I get to brag on the things that you're doing, collaborate with a faith-based organization. And as she said, she highlights it. And so I am really that person. As they said, Linda was talking earlier, some have to be 95. I'm a 50% girl. Give me an idea, I'm gonna weigh the pros and cons, and then I'm gonna see how to get her done. Yeah. And so this is one of those things where I'm like, oh, we're connecting resources. Let me go try it. It was Gubby County because that's where I live. I'm like, let me see if this will work. And so what we've done is been able to start at the first of the year having meetings. And what I do is bring in resources that they say they need and have those people come in and just tell what they have available and how they can serve the faith-based population. And it's just kind of taken off. So we met virtually a few times, and we started out with Scott Comer, who's with 1440 Promise Prison Ministry, and so a lot of the pastors were interested in how to tag in, work with him, collaborate with him. Then our District 7 came and discussed what resources, like she talked about the car seats. A lot of the churches didn't know that their members could go through car seats, and so we were able to connect that to the health department. Then Andrea talked about what she's doing. So in person, one of the asks was the youth pastors and youth ministers were like, how do we know if there's something going on? And then who do we report it to? Like, what's that process? So OK DHS came out and did an amazing presentation and let them know, hey, you know, sometimes you telling can save a child's life. They just gave a lot of different practical information and steps to help. And then Hunger Free Oklahoma, they came out and talked about the feeding sites and where the kids could go during the summer and get the food. But then the flip side of it is they talked about grants, the opportunities that were available for churches to be a food site or a nonprofit. One of our largest sites is among the King Community Center, and every single day they were pushing out like 900 people. And so it was awesome because nobody in our community knew that was happening. And they also didn't know where their kids at their church could go get food. And then Tammy Williams came out and talked about the science of hope, and she's one of my favorites. Now Andrea is available. She's trained that she can come out and do that training as well. But it was more of an intro. I know we've had the long, full training, but this was just an hour and a half where she came out and just kind of dropped some nuggets on them to see if they're interested in the 4-hour training. And then Fostering Hope, I'm going to show you a photo. One of my absolutely favorite things is this is Annie. She was my daughter's kindergarten teacher. And Fostering Hope was her baby. It's pretty much, I think she said, 60 counties in Oklahoma. And if you're a foster parent, you know about the process that there's a window where a child has to go somewhere before some family member or someone comes and gets it. Well, Fostering Hope has these agencies set up where they can go there. It's a nonprofit where they can go and they're holding, in that process when they're getting ready to leave, they give them a bag, all kind of things. And so you see the tubs. She has buildings with fall clothes, winter clothes, spring clothes, summer clothes. They have teddy bears and blankets. They have little crochet hats that ladies have donated, some blankets, books. They have all kind of things that go in their bag for that child. But then they also do birthday parties for the foster kids. So it's just a beautiful, beautiful program that is available. Our community did not know about it, didn't even know it existed. And so it was just great to go tour it, but then also to go and let them know what's available. One thing that I do like, this is Tammy, and this is one of my favorite quotes. She talks about hope is the belief that your future will be better than today, and you have the power to make it so. This right here was the Youth Leadership Summit that I was able to be the project manager of. And we brought Tim Tebow into the community for 1,100 seniors to come and have a leadership day. One of the awesome things was the network of pastors that we work with to let us get in on it. And so they donated $1,800, and we were able to give these little cards with $100 on it. And you would have thought the kids won the lottery. I mean, they were screaming and running down the stairs, and one was like, "That's my dad's money for the month," you know, and another was like, "This is food," and that was just a beautiful thing to connect those pastors to the work that we're doing. So a lot of times you're doing awesome work, but there's also another group of people that want to get in on it if we tag them in. This was our first meeting. A lot of them didn't want to get in the photo, but these are the ones that did. But that's my daddy. My daddy just recently passed, but he's one that connected me to a lot of the pastors in the community. And then this is when we toured Annie's facility and brought in some business people as well as sorority and fraternities. We have 35 that have attended, 2 alliances that represent 60 churches. We have the Ministerial Alliance, but then we also have the Christian Ministries Union, as she talks about. Sometimes there's several alliances. One of the success stories was that Annie has been trying to get in with the pastors to share about the Fostering Hope, had no way to get in there. And so this was an opportunity for me to get her before some pastors, but also through email, share what she does and connect her. And then also she had foster parents who were trying to adopt, and she didn't know anything about. Andrea told me about that there's a way to do it through the system that's free. But
she didn't know anything about it. So she had a person that actually attended, owns her own business, and was able to say, hey, once a month I have a family for free. Go through the adoption process. So it was a cool connection. Our next steps, Andrea and I will be going to McCurtain County. We're trying to get our date for October. As she talked in the first session, her schedule was kind of yucky, mine too, but that's exciting to be busy. Also, another thing that's not on here is that I took a training called Within My Reach. You may be familiar with it. It's about helping individuals make better decisions and for relationships and for life, communication skills. And for sure, it was one of my favorite trainings I've ever attended. So I'm going to offer that pretty quick. I'm trying to get it, want to do it October 16th for 5 weeks. My goal is to try to use the pilot group to offer it to people that are in their congregations that need help with making decisions, 18 to 100, right? We all know people that just keep making bad decisions, don't have great communication skills, and you do too, huh? Want to connect them to get into class and help people. And then with that, we're here. We're excited to be here. We're excited. So what can we do for you and how can we collaborate? Let us know of an event that you are collaborating with faith-based community so we can brag about it, share that about, get it out. I love photos and we love photos. Andrea likes to have photos to put on her website. So if you'll take a photo, it's always great to have. And let us know if you need resources. This is what we do, is try to connect people. And one cool thing that you always can do is if you're doing an event, think about the faith-based community. Think of, bring them to the table. Who can we bring to the table that will connect us? One pastor may have 100 members, one pastor may have 50, one pastor may have 1,000. You can reach a lot of people on one Sunday if you just connect the right people to the work that you're doing. Delbie? Yes, ma'am.
Are y'all, is the plan to bring it to the metro area or west side?
So I've had several ask about Oklahoma City, and if there's a need, for sure we will. For sure we'll go wherever there's a need or request. Right, Andrea? Here's Andrea's information. For me, I'm real simple. It's just my name, Delbie, DELBIE, @health.ok.u. And we are excited to collaborate with you guys and share ideas or connect. You might connect here is Victoria and Melissa Sims. And so if they ever even want to do a day of just trying to get resources to the faith-based community, I'd love to collaborate with them to do that, to help you guys. And with that, any questions for us? We'll be happy to take.
Great work. That's amazing work.
And our friend at Department of Mental Health and Substance Abuse wanted to make sure that we shared about this today. They are actually starting a Faith Forward. It's going to be a quarterly lunch and learn. It's virtual. And the first one's coming up in October. It's going to look at some county stats, Oklahoma prevention needs that they did. So information, grab it as you're headed out, share with people. It looks like Delbie made enough copies that everybody can put about 20 years.
Thank y'all for coming.
Thank you for coming. Oh, don't forget your surveys.
Yeah.
And then really we're here for any other discussion, questions, anything else that would be helpful.